so today we will be performing the ear exam. So to start off, we're going to look at the patient's auricles. We're going to be looking at the size of them, making sure that one side is equal to the other, they're symmetrical. Along with that, we can be looking for if there's any nodules or lesions on the auricle itself. So we're going to look at that. That looks good on this side. Size on this side looks pretty similar to the other, which is good. There's also no sort of nodules or lesions. And then we're going to look at the external ear canal. So we're just going to look inside. We're looking for any discharge, swelling, any other sort of lesions in there, which there is nothing abnormal on this side. And we'll do the same over here. And it looks pretty normal over there as well. All right. So then from there, we're going to go into the tug test. So patient, I'm just going to pull on your ear and push on it. I'm going to push right behind your ear as well.
Okay.
So let me know if there's any pain with that, okay?
Sounds good.
Come in here. Pain with that.
Nope.
Pain with that.
Nope.
Right behind. Pain with that.
Nope.
All right. Repeat that over here. Pain with that.
Nope.
Okay. Pain with that.
Nope.
And pain behind the ear.
Nope.
All right, sounds good. So then we're going to go into the internal ear exam here. So we're going to use the otoscope with the speculum on it. So if I can have you just turn your chair just a little bit. All right. Perfect. So we are going to come in with the speculum with the patient seated at the same level. We're actually going to pull their auricle up or down and back. And we're going to insert this. So right now we're looking for any sort of earwax, what color it is, which is kind of yellowish. We're looking for discharge and any sort of swelling. And then we're going to go a little bit farther until we see the tympanic membrane. We're looking for color, which is a grayish pearl color. Looking for the conal light, which is anterior and inferior to the umbo. And we're making sure that there's no bulging, which there is not. And I'll repeat that test on this side. And I should say too, for the patient's left ear, I am using my left hand and my left eye. For the patient's right ear, I'm using my right hand and my right eye. So same thing, we're going to pull the patient's auricle out and down. And if I can have you rotate your head a little bit more that way, that'd be awesome. So we're going to come in here, insert it into the external ear, looking for any earwax, swelling, any abnormalities. Then go a little bit farther, looking at the tympanic membrane for the grayish pearl color, conal light, and if it's bulging or not, which it was not.
Okay.
So that was great. From here, we're going to go into the auditory acuity test. So I'm going to come behind here.
Okay.
And I'm just going to rustle my fingers. So can you hear this?
Yes, I can.
Can you hear that?
Yep.
Okay. So I'm going to make that noise and let me know when you can hear it on that side, okay?
Okay. Yeah, I can hear it. Yep, I can hear it.
Okay. So it's about equal distances on both sides, which is good. And then from here, we're going to be using the 512 hertz tuning fork to perform the Weber test. So all this does makes a noise like this. Can you hear it?
Yeah, I can hear it.
Alright, so I'm going to do that. Place it on top of your head and just let me know if you can hear it in both ears and if it sounds the same in both, okay?
Okay.
Can you hear that?
Yeah, I can hear it in both ears.
Sounds the same?
Yep.
Alright, perfect. So next we're going to perform the RIN test. So I'm just going to do the same thing. I'm going to place it right behind your ear here and then let me know when you can no longer hear it.
I can't hear it anymore.
Can you hear this?
Yeah, I can hear that.
Alright. So then we're going to perform it on the other ear.
I can't hear it anymore.
Can you hear that?
Yes, I can hear that.
Okay, so that is normal. And finally, we're going to do the Schwab box. So I'm going to do the same thing, and you just let me know when you can no longer hear it, okay?
Okay. No.
And I cannot hear that either. So we're gonna do it one last time in this other ear.
No.
And I can no longer hear that either. So with the Schwab box, we are just comparing the patient's hearing to my hearing. So that concludes the ear exam.